All right. Okay, can you see that? Stop making
Yes.
fun of me, Crystal. Okay.
I'm not. I promise you, I'm not. I said I could see it.
Okay. All right, here's where I want to get. Here's where I want to be. You guys have heard of Tana's clinical judgment model, right?
No.
Okay. Well, this is the clinical judgment model, reflecting. Okay. This is when you're reading your questions, ability to identify what occurred, what the nurse did, or what is she going to need to do, how might one adjust the action differently. Okay. Responding, ability to decide on whatever your course of action is. Okay. Noticing the process of perceiving important aspects of the situation, interpreting, right? So that's clinical judgment. Reflecting, no, or noticing, reflecting, responding, interpreting. Okay, you guys all know that all these exams and HESIs are about clinical judgment now, correct? Right? What?
Miss Marva, I don't think she knows she's off mute.
Oh, okay. Study strategies to promote clinical judgment. Okay. Anticipatory reflection. What is the question saying? What is the question asking? Case scenarios. Create decision-making mind maps. What are you thinking? Once you read the question, right? What cues are in the question? How's your decision making going to come about based on the age of the client, the status of the client, the comorbidities, the health, the risks, the um whatever the big picture is, you have to take everything into account, okay, as you're making your decisions. Okay. um like I said, med surge questions. What systems are affected? Is this acute? Is this chronic? What's the patient's history? What's the desired outcome? All right, these aren't memorization questions. These aren't knowledge questions. These are practice questions on your HESI.
Would that be? I can't remember. Never
Go
mind.
ahead.
Never mind. This
As
that's
far
all.
as far as content and knowledge, you have everything you need in that HESI prep. Okay, you have everything you need, right? So you can memorize that. That's fine, but you have to be able to put it into practice, right? So let's say let's think about this: anthrax incubation. What kind of question might be asked with regards to anthrax incubation or anthrax in general that you would have to make a clinical judgment on? What kind of question might be asked? I don't know the question. I know the topic they're going to ask an anthrax question. What question might be asked to test your clinical judgment? I'm
how to
asking you guys.
how to treat the symptoms of anthrax
Sure.
from the
And
And
where
time
and where
period.
do you think they got exposed?
okay, and they're presenting with certain symptoms,
Mm-hmm.
right?
Mm-hmm.
And so what's the plan? Think of, okay, you've done your assessment, right? They have signs and symptoms of a potential anthrax exposure, right? Then you're planning, I'm using the nursing process here, then you're planning for what you're going to do to make this patient better, to make these signs and symptoms go away, right? And then your evaluation process is, did those interventions work? Right? Let's look at disaster communication. What's a clinical question about disaster communication? What's a clinic? I mean, go ahead. Does anybody want to jump in here?
How a nurse can delegate taking the residents to a certain area in the facility if something's going on.
That's perfect. That's perfect, Lisa.
And not treating anybody like in the midst of the chaos. Like so
clinical judgment.
You'll cause more chaos. So
right. So think about it. You have a disaster.
Water, like never mind.
You have a disaster. You have clients that are injured. And so you have to make the judgment, clinical judgment. How are you going to get these people to safety? Right? What about flu surveillance? Take what you know about flu and put it into a clinical situation where you're going to have to use your clinical judgment skills with regards to flu surveillance. What might that be? What might that question look like? That's how I need you to think about this HESI. Taking what you know about flu surveillance, assuming you're in a situation where you are performing flu surveillance, and how do you use that information to make your clinical judgments? Anybody have any thoughts?
Probably prioritize on who needs a flu shot more than others.
Sure. That's excellent.
So say like I have a critically who has asthma versus the 60-year-old I'm gonna say probably like a diabetic or something like that, but not chronic, something like that.
And so maybe the question would be what? Who do you prioritize or who do you encourage to get flu vaccines?
The asthma patient.
That's what I mean. Yeah, exactly. So that's exactly how I want you to look at it, just like Crystal just described it. She added in all the different potential scenarios with this client, right? And in the end, one of the goals of caring for this client would be a flu vaccine. What about obesity? What do you know about obesity? Let's say you're presented with a obese client at the urgent care who's having difficulty breathing. What is your clinical judgment model look like? What are you going to be looking at?
It's BMI.
Pardon me? Pardon me?
It's BMI.
Yeah. But you're having to assess why. Go ahead.
I said, why don't you look at the cardiovascular system as well? Because if they having shortness of breath, it's probably something going wrong with his chest.
Bingo. Exactly. 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 What about lipid screening? Why would you be doing lipid screening? And what's the significance of that?
Lipid screening would be to see
high
if
blood pressure.
Pardon me?
High blood pressure.
Possibly.
High cholesterol.
Possibly.
Oh,
okay. Heart disease.
Okay.
Oh, you say heart disease. I was just about to say that.
how is their obesity affecting certain systems? Right?
Mm-hmm.
So that's what I want you to do as you're reviewing this HESI prep study guide, is looking at the topic and coming up with scenarios that might be asked to you, and how do you apply that clinical judgment, your clinical judgment skills, into answering those questions about these topics. It's not going to ask you, HESI's not going to say, how do you do an elder health assessment? That's not what it's going to say. It's assuming you know how to do an elder health assessment, and you're presented with a clinical scenario to which you need to answer. It's not going to ask you what's a vision screening for preschool. It's going to give you a scenario, maybe about why we screen kids in preschool, what's the significance of it, right? Obviously, to recognize vision issues early. Does that make sense?
Yeah.
Let's go over some
Could you do because I'm still not understanding the quality care for the high school population. I don't know it.
well, really, Crystal, what I can see is topics. So let's go to that topic. Where is it?
It's right after lead poisoning action.
The what?
It's on page on 4. Go back up. Yeah. You see it?
Mm-mm. I'm not seeing it. But I know the topic. What is it? Quality?
Yeah.
Quality care, high school population.
Okay. So we know the population, right? High school population, quality care. What do we think that means? The other thing I know about the HESI, and this may help in this question, is from the students that I met with at the end of last term, the two things they told me were that this exam was very heavily med-surg focused, but it also had several primary, secondary, and tertiary questions.
Okay.
Okay. So, what's quality care for the high school population? Well, I don't know. I'm going to think of that as a primary, secondary, tertiary question. What would be some primary interventions we could do at the high school level?
I can
Like
read what I
talking about
put
like
down.
sex
I don't know if
education.
it's correct.
Vaccines, education.
Okay.
Yep.
Exactly. What would be some secondary interventions we could do with high schoolers with regards to quality?
STD check.
Screening.
Um,
Screening for STDs, screening for substance abuse, screening for suicide, trying to find our at-risk obese students, our at-risk behavioral students that might be prone to bullying or harassing, right? And what about tertiary at the high school level?
treatment, like maybe giving diabetic medication or advising
If they
therapeutic.
sexually active, already use condoms or something like that.
Let's say they're obese. We're helping them manage
a healthy diet.
Right? And we're helping them manage that. Let's say they're diabetic. We're helping them manage their diabetes. Let's say they're pregnant.
Give them
resources. Yeah.
Exactly.
Like make sure they have daycare so they can come back to school, making sure they get their homework.
Exactly. Yep. So that's what I think that means, Crystal.
Okay,
Does that
It's still
help?
a secondary. It's a primary, secondary
I
type
think
of.
I think
Okay,
that could potentially be one of the primary, secondary, tertiary questions.
that must be for the community education too. It say evaluate. So I guess that's a secondary, primary question too, because I couldn't really.
What is it? What's the topic?
It's community education.
Well,
And it say
let's think about that.
evaluate.
Okay, so we know they're going to ask a question about community education.
Community. Mm-hmm.
Okay, so what might that question be? Um, it could be many different questions,
Okay.
but I mean, what do we think? Community education. Maybe assess it. Maybe they're going to ask about, how do you read your room? Who's your
Oh, okay.
audience?
Okay, got you.
Right?
Got you.
I
Yeah.
mean, that would be clinically focused, right? Because you
Yeah.
have to be able, and don't think clinically focused as far as, you know, direct patient care. Clinically focused also means that when you're in the community, when you're doing community education, you are assessing who you're teaching, right? Picking your topic and making sure that you can adequately reach out to all the members in your group that you're teaching. Remember we
Oh,
talked
okay.
about that,
Like
and
it's like say like you they having a community meeting or something like that, and how would they get all this information out? Will it be something like that?
I don't know. I mean,
I don't
what
know
about if
either.
there's
I'm
a
just
language
saying.
barrier? What about if there's a language barrier?
Yeah.
How do you reach your whole audience? What if some are visually impaired? What if some are hearing impaired? What if some don't speak the language? What if some can't read? Right?
Mm-hmm.
And we went through all that in class. I mean, you guys should be really well prepared for this. Really well prepared. I just want you, I want to move you away from thinking you just need to memorize things. Not only do you need the knowledge, but it needs to go into practice. As if we're caring for a group in the community that we're doing education with, or we're caring for a, think about it in your clinical settings, whether it's a stroke, whether it's diabetes, whatever they've been in the hospital for, they're now coming home. They're getting discharged back to the community, whether it be their home, whether it be a rehab facility, whether it be an assisted care. So now we have to shift our thinking of how do we care for them how do we now shift our care from an acute care setting to a community setting, right? So how do we care for a stroke patient when they're in their acute phase or in the hospital? Now we're going to bring the stroke patient home. What is that care going to look like in the home?
Right. So first of all, we gotta get them a case manager, but just in case they live alone, so they might need a case manager. We're gonna look at that first. We're gonna actually see who's around to help that person. If they don't have anybody to help that person, then we're gonna get a case manager. If there's things that need to be moved, then we have to go to the house and assess.
Do your assessment at the house. What are the needs in the house? The needs in their house are going to be a lot different than the needs in their hospital room.
In their hospital, yes.
Right? It seems like there's a lot of questions that have a med-surg diagnosis, but caring in the home.
And they did have a question on there. I think it was probably more so, if I can remember, about abduction. It's like a abduction or something like that.
What do you mean?
I'm trying to think of the question. All I know, it was like for elementary students walking home. I remember that question. I was like, what?
Okay, well, let's think about that. What you can remember is a child walking home from school, and the question was about abduction. Okay.
Like,
So,
I guess, like, say, like, what would you do? Like,
okay.
what, I
So
can't,
the question's probably going to revolve around teaching with that question, right?
okay,
How do you
okay.
teach a child? I don't know. I'm thinking out loud here, right alongside with you guys. Okay. What do we do? What can we teach that child about safety?
Find a
Right?
safe place to go, probably. Know your
Right?
phone numbers. Know the phone number.
Exactly. Exactly. I mean, I wish I could be more specific with you guys. I can't because I can't see the questions, but I can see the topics that are covered. And that's what this whole HESI prep is. So as you've researched the topic, you should hopefully now be able to put it into practice. That's the goal. That's going to be your key to success on the HESI. Okay. I want to go through, and I know I've talked a lot about this in class, but I want to go through some testing techniques just to refresh your memory. Okay. Here's our 10 steps to answering a question. Covering the options, and we'll go through each one. Read the question. Determine the style of the question. Is it positive or negative? Identify the key words in the question. Ask yourself, what is really being asked in the question? Rephrase the question in your own words and answer it. Uncover the options and look for one that matches what you think. Remember, that's my example of read the question, cover the answer, come up with an answer in your mind, and then look at the answers and see if one of those matches. Review the other options and rule out any options that are clearly incorrect. Consider the options that are left based on nursing principles and your knowledge. Make your selection. So that really is what we talked about all term. My suggestion is you read the question first. It's your first look at the question. You pull out or write down any cues, any words that jump out at you that are going to assist you towards the right answer. Right? And then when you look at the answers, which ones can you eliminate immediately? Maybe there's one, maybe there's two. All right. So that when you go back and reread the question a second time, you should have key words, cues, phrases pulled out, and you might only have two answers to choose from versus four. Okay, first step to answering a test question, cover the options. Maybe use a sticky note to cover the choices. I don't think you can though on the HESI, but you do have a piece of paper, right? Or a whiteboard. You can use that. Okay, so maybe covering the answers will help prevent you from being distracted for the correct answer. Okay, read every word of the question. All you overthinkers, do not read into the question. Okay? What's my rule of thumb? If the information is not in the question, it does not exist. Right? Determine if the question is positive or negative. Positive means maybe they're asking, what should the nurse do? What's the first action? A negative question, on the other hand, we had several negative questions on all three of our exams and in our quizzes, right? So it's negative. What should we avoid? Right? What behavior or what language indicates the need for reteaching? You guys should be pretty good at determining whether it's positive or negative at this point. Find any key words in the question. We've talked about this all term. Which words or phrases provide critical information? Maybe it's the age of the client. Maybe it's the setting, the timing, a set of symptoms or behaviors. Okay, here's an example. The nurse The nursing actions for a 10-year-old 1 day post-op are different from those of a 70-year-old 1 hour post-op. Make sense? Then ask yourself, what is it really asking? Maybe you could rephrase it in your own words. Sometimes in questions, there's a lot of information that's really not pertinent. You have to be able to pull that information out. It will help you eliminate non-essential information. So if you got a really lengthy question, read it again. What are they really asking? What in that question do you not need to answer it? Every word of a question is not critical. Maybe trying to rephrase the question in your own words. And by rephrasing, you may be able to have a better understanding in your own mind of what the question is asking or what you've rephrased it to. So number 7 really is, if you take advantage back in numbers 1 and 2. If you really do read the question and cover the answers, or just look away or whatever, and try and come up with your own answer in your head. I find that to be a very effective strategy. And then when you uncover the answers, see if one's there that matches. Well, this is a good tip here. Some HESI hint. A person who prescribes treatments may be referred to as a physician or a healthcare provider rather than a doctor. You need to be aware of that. An unskilled person who assists a nurse may be referred to as a nursing assistant, nurse's aide, patient care technician, UAP. So be mindful of those different phrases. The terms orders may be referred to as prescriptions. That's a good one. Next tip is rule out any options that are clearly incorrect. Based on your knowledge, you can probably identify 1 or 2 options that are clearly incorrect. Pull them out. Mentally mark through those options in your head. Or write them down on your paper. And think about it. When you go back to review the question a second time, you'll have key words and phrases pulled out. Plus, you'll have reduced your answer bank to 2 answers to choose from, or 3 from 4. Okay, so now that you've reduced it down to 2 or 3 answers, right? You need to select these based on your knowledge of the subject, of the concept, nursing process, and the clinical judgment that I went through process, the recognizing cues, analyzing cues. So then you differentiate between the remaining options, considering your knowledge, the role of the nurse, ABCs, right? So safety, and then Maslow's hierarchy of needs, right? Remember, prioritization, safety, risk reduction. These are all things we think about in that clinical judgment model. And then lastly, you make your selection. And this is important. You know, you guys, I know you're stressed. I know this is going to be a really busy week. Okay, but you have to have confidence in yourself. You have made it this far in the class. You have the knowledge, right? You've gone through what, 5 quizzes, 3 exams. If you need to re-review, you have detailed weekly notes. You have 3 study guides. You have a HESI prep. If you have a good understanding of the concepts, you're going to be fine. And like I said, med surge, med surge, primary, secondary, tertiary. Okay. There are geriatric questions. There are pediatric. Well, think about it. Geriatric questions in the community. It's on your HESI prep. How do we do a geriatric assessment in the home? What's good nutrition for the elderly patient? How do we do fall risks, fall assessments? Lots of pediatric questions, it looks like, based on the HESI prep. Okay, so this is a mixture of all your classes. Do not second guess yourself. Right? If you've studied and prepared, questions may seem easy or just plain common sense. Yeah, they will. And you need to trust that. Okay, you guys have been preparing for this all term. Okay. You came to class, you participated, you did your exams, we did exam reviews, you have an understanding of where you were short, where you fell short. Go back and review those areas. Okay, this is a good reflection of this exam appears to be, from what I can see, what the topics covered, appears to be pulling knowledge from several different classes. Your med surg classes, your peds classes, your OB classes, your geri classes, your fundamentals class. You got this. Questions? You got this. This isn't all new stuff. This is just pulling it all together. Because we practice all those other classes in the community. We practice med surg skills, we practice ped skills, we practice OB skills, geriatric skills. All those age groups and populations leave an acute care setting, and a lot will require care in the community. And that's where we come in. That's where this class comes in. What are you guys thinking? You ready for it? Anybody?
I'm not ready for it, but hey, it's either you gonna go in there, you can only do what you know. So
You're not ready for it?
not at all. But it is what it is.
Okay.
We are choiceless.
You're what?
We are choiceless. We got no choice.
For sure.
We got to face our fears.
Yeah. But you have all the tools you need to succeed with this exam. You have all the tools you need. I have to answer any chat questions. Hang on.
I will say that like doing practice questions has exposed me to like a lot of different situations or disease processes that I didn't know about. So I think the NCLEX practice questions of like adult health, and then sometimes I even do just all systems for like different age groups that has
Mhm.
exposed me to a lot that I didn't even know really about that much.
Where are
And
you
then
getting your
I redid
where,
my CJ Sims too. So I think that's a lot of help too, because a lot of the questions sometimes on the HESI are kind of set up like CJ Sims, where they give you nurses' notes and then you have to guess. I mean, not guess, I mean, try to make an educated response about what the disease is and like what symptoms and then what intervention you should do. So I felt like doing CJ Sims, just some of them, not all of them, obviously, that's a little too much for me, but doing some of them really helped me to like kind of better my critical thinking in that way.
and you got your CJ Sims from your other classes, correct?
Yeah, you can access it through your other classes.
Yep, 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 yep. And Chelsea, where did you do your NCLEX practice questions from?
I go on the, you know how we do them every when we submit them for weeks
Mm-hmm,
or whatever.
mm-hmm.
I go to study mode, and then I click content area, and then I click adult health, pediatrics, and then I pick all body systems. It'll ask you what systems if you want to specify, but I just click all of them. I select all, and then it'll give you like a good like. I think I have like I want there's like 1,000 something questions that you can blow through, and it'll tell you like strategies to pick out the best answer. There's like a strategy box at the bottom that will tell you like to look for select words to let you know that this might be the best answer or this might not be the best answer, and then
Mm-hmm.
it explains to you why you chose if it was wrong or if it
Mm-hmm.
was right.
That's a pretty comprehensive review.
Yeah, I think the CJ Sims were the most helpful because a lot of the questions are based like CJ Sims kind of based.
Right. Okay, they're like case studies.
Yeah, a lot of case studies are on there usually.
Yeah, there is. I think I counted like 6 or 7.
Case
All I
studies?
know, yeah, it was a lot. For me, it was a lot because I was like, oh my God.
Did you review them?
When I got there, no, I thought it was gonna be easy, but no, it fooled the hell. Excuse me, it fooled the heck out of me. So I didn't study. So the study guide that you gave me, I'm studying this time. So
The HESI prep?
yes,
Yeah.
it was. When I went over it this time, I was like, oh, okay. Some of this stuff that I saw, like the tuberculosis was on there,
Mm-hmm.
the TB was on there, the SARS was on there.
Mm-hmm.
I know it's some note about hypothermia. Now hypothermia was on there, but it was like,
Well, you have a different study guide from the last time I saw you.
yeah, no, I got the new one.
Yeah, I know, I know, I
Oh,
know. But the last time you did this, I try and update every couple of terms.
yeah.
Um, so I mean, we've covered the concepts, and it's now you guys taking your knowledge and putting it into practice. Chelsea, I like what you did, going back into NCLEX and just kind of playing around with it.
It'll
Yeah,
You know,
also teach you like
CJ
how to
Sims
do
is
your
good
case
though.
studies too.
Yeah, CJ Sims
Like,
will help how to do this case study though. She right now.
yeah,
So you right
say
about that.
that. Wait,
I'm gonna go
say that
do that.
again. I didn't hear that. It teaches you what?
it also teach you like how to do like your case studies because usually like sometimes when I get the case study on the HESI, I get overwhelmed with information because there's like nurses notes and there's labs and then
Mm-hmm.
there's other things like whatever observations or whatever the case is, but they teach you how to take it like step by step, and it'll basically say like what key symptoms do you have in your nursing notes. Okay,
Exactly.
now that you picked some of those out, let's go to the labs and compare to that. And don't I feel like don't look at the clock because that messes me up every time I look at my time. I feel like that makes me even more stressed. I don't know if that helps anybody, but I feel like that makes me 10 times more stressed when I look at the time and then I'm trying to hurry through like nurses notes and I just guess the wrong. thing because I'm not even paying attention to what I'm looking at. I'm looking at a clock. So I would say to do like, I mean, I don't know if I'm correct, but I would say to do like your NCLEX practice questions, to go over some CJ Sims if you have time, and then just to take it one thing at a time and pick out key things that are in your nursing notes.
Yeah.
Now I'm
So
gonna say it like this: the CJ Sim questions, Miss Marvel. Those it's just like it is just like the HESI. I promise you that.
that's
Cause
good.
yeah, it's
We
just like
don't
it's
have CJ Sims in community, but
No,
you
but
have,
in all our other classes though.
but
We
no,
have
that's good. That's
yeah.
good. And whoever just said that CJ Sims are just like HESI questions, you are correct.
yeah.
That is
And then it's gonna be most
absolutely correct.
and
And
then
the
it's
more you
not
do,
going to
the
be
better you
most
get.
Pardon
yeah.
me?
I said the more you do, you get a little bit more comfortable with it.
Exactly.
Because at first,
Well,
when we first doing when I first did a HESI with the CJ Sim questions, the case, it was really hard. But once we started doing the CJ Sim over and over, I got a little bit comfortable with it. I wasn't rushing through it, trying to just get
Yeah.
past.
So my suggestion would be when you get into the community HESI, see if you can take those questions and look at them through a CJ Sim perspective, right?
You
It's
could
not
also
yeah.
go to the HESI review. If you go to your student resources, there's a Saunders link, and then there's also a HESI review, and they have all the NG questions, samples. And if you go to the very right-hand side, it teaches you the rationales, it teaches you how to make
Perfect.
decisions, teaches you everything.
Yeah, the exam it's not the exam part, it's the study part of it.
So
In
you've got the tools. You've got, I mean, Crystal, Chelsea, Laura, I mean, you guys are bringing up. That's why in week one, I went through all those resources in your student package. That Saunders link to the NCLEX. I mean, you've got all the resources. Your CJ Sims from your other classes. Just apply that to community. It's a case study, right? The difference is you're taking that patient from an acute care setting and going into the community. That's the transition. Nothing changes about how you do an assessment or how you prioritize or how you come up with a plan. You're doing that in the acute care setting as well. It's just going to look different in the community setting. But it's the same nursing process that you use, right? You guys will be good. You guys will be good. Does anybody have any other questions? I think if some of you guys have mentioned some wonderful resources, if other students haven't been accessing those and you'd like to, and you still have time before the HESI, I highly suggest that you go back and look at your other CJ Sims. You know, look at your, like Chelsea did, go back and pull up some NCLEX questions. Pull up some and do some practice NCLEX questions for pediatrics, for geriatrics. Right? Chelsea?
And like honestly, like you have said, as far as like doing the NCLEX questions now compared to like when I first started like nursing school, I have a lot, like you said, like I have a lot more knowledge to answer the questions. There's some disease processes that like I'm not aware of, but there's a lot that I'm like, okay, we have went over this in class. We have seen that in especially pediatrics. Like there's a lot of disease processes that we hit.
Pediatrics and geriatrics is what I see a lot of as far as those HESI topics. And then, you know, if you need to brush up on your primary, secondary, tertiary, do that. I got that feedback from the last term students. They said, oh, we were so surprised at how many primary, secondary, tertiary. I mean, it's simple. If you understand what each one of them are, the question should be a no-brainer,
Oh
right?
yeah, it was a lot of those on there too.
Yeah.
And then I didn't understand those when I first, very first took your class. But now that I understand it, now I'm gonna go through them like that now.
Exactly.
Because I was like, what
Exactly.
the heck? So yeah.
Exactly. Yeah, you guys just
But
please have the
y'all, we got
confidence.
this, y'all. Don't. Yeah, we
Exactly.
got this. We got
Please
this.
have the confidence in yourself to do well on this test. Shoot for the highest score you can get. Don't be worried about, if you looked at that what if scenario, oh, what do I need to pass my HESI? Don't look at that. Just aim for the highest you can do. You have all the tools. You've done fantastic through the class. And just please be confident in yourself. You got this, right? You're going to be a nurse. Be confident in your abilities, your capabilities. You got this.
And if y'all still don't, feel if y'all still don't have to listen to the lady on Nexus Nurses, she sounded like she got like a list and type in community. She was helping me with some. She gave me some tips too as well. Like she'll put a question up, and then you'll answer the question first, and then she gonna tell you why this question is the answer. So y'all look at her. I think it's like 30 minutes long or something like that. But
What is
y'all,
it? What is it?
Nexus Nursing. It's on you. She on YouTube. It's a black lady. She sounds like she got a list, and it's come up with community. Because when we was talking about like the elder people, she was like, it's two things that you need to know. Is about you always found out what the client knows, and then is you're gonna and then after that you're gonna assess the willingness of teaching. Before you teach, you're gonna assess the willingness. So
Exactly.
are they ready to? So yeah.
Exactly. Well, exactly. I mean, that's part of your assessment with anybody you're caring from in the home is what do they
Yeah.
understand is going on?
Yeah. She
What do
made
they
it.
understand? What do they understand about their disease? What do they understand about their accident? What do they understand about their recovery? I mean, you
Making
have
sure
to
that
assess.
independent.
That's part of your assessment. What do they know about it? How serious is this going to be somebody who doesn't pay attention to instructions and is at risk for falling?
And
Right?
also, she said know the difference between public health and community health. So I was writing that stuff down too. So
What did she say the difference is?
she said that she was like, she said public health is just like everything, and then community health is just like in the community wise.
Yeah.
Like a specific group, like
right. Public health nursing is the overarching look at the whole community.
Yeah.
Where community-based nursing is you're in the community taking care of clients that need health care. Whether it's for a chronic illness, an injury, an accident, or you're teaching, if the community has certain needs, you guys are fine. I have all the confidence in the world you're going to do good. I really do. If you've prepared, if you've done your due diligence and done all the things we talked about and can truly shift into knowledge, truly shift taking your knowledge and putting it into practice. Because the first day you go out and work at your new job as a nurse, they're not going to be asking you, what's the definition of public health? Okay. Or what's the definition of asthma? The assumption is you have that knowledge. Now you're going to be taking care of patients that require your clinical judgment. That's the whole next gen. That's the whole shift to next generation. Okay. That's all I have. Sorry for the interruption with the internet. I'll send part one and part two. Part one was only a few minutes, but that's okay. I'll send that. And then I'll send this part two. Does anybody have any questions? Do you feel better after chit-chatting for the last hour?
A little bit.
A little bit. Okay. I'll take that. Let me know how you do. I'll be checking HESI scores and grades throughout the week. But if you want to shoot me an email that you took it and what you got, and don't procrastinate on your remediation. Just get it done. Get it done. Okay?
She got away. But she left. All right. Well, thank you, Professor. You have a good night. More balls are missing.
Thank you, Professor.
I can't hear. I can't hear anything.
Oh.
Okay, go ahead. You're welcome. You're welcome. Crystal, are you going to stay on? Okay. All right. Well, good luck on your HESIs, everybody.
Thank you.
Oh, Crystal, I need to log off this recording and then come back in again. So just come back in 2 minutes. Okay. So, yeah.